Now, we've heard how much health costs Canadians, and we've heard that the aging population is going to continue to stress the system. And we know that with aging comes chronic diseases and so on, and that we've got spending growth that's running certainly ahead of inflation and faster really than aging in population too. So this is a huge challenge, and innovation clearly is one of the only ways we're going to do anything about it. Now, it's interesting. I think government appreciates that to some degree, and as we could probably say that investment in health research is, if not the largest, certainly very near the top of government spending when we look at federal and provincial activities. The focus of that spending has been predominantly, I would say, on cures and treatments for diseases, however, with limited effort on process improvement and cost containment. Now, I'm from NRC. NRC has played an active game here, and since the others have given you their commercial message, let me take a moment and explain a little bit about the National Research Council too, and I'll ask the same question. Does everybody know the NRC? I hope so. The National Research Council has been around a long time, almost 100 years. We're the largest public research organization in the country, about $1 billion a year and 5,000 people odd. We also have a good track record in health. Things like the pacemaker emerged from NRC, meningitis vaccine. We're working on diagnostics today. We've got a surgical simulator in the works, a variety of tools and various other health-related activities, including support to the pharmaceutical industry for drug development. But having said all that, the challenge remains that innovation in health, as we've heard, is underperforming relative to the investment that's going in. And that's notwithstanding all the terrific things that we can talk about, because there are really great examples of Canadian innovation in health. Health is not alone in that fact. It seems that this applies to all sectors in Canada. So when you go and look for sectors as good examples to say, well, what could we learn? There isn't actually a lot. So let me try instead to talk a little bit about how we might consider some of the challenges that confront us in innovation in general and health in specific, and just what it is that there is some possibility to change easily or maybe not so easily. I think I'd like to talk about 5 major items. The first one is lexicon, just the definitions that we use. I'd then like to spend a little bit of time about what I would call misaligned expectations, talk to some degree about the need for focus, some of the, what I would call the flawed assumptions about how the innovation system works, and then finally the design of the health system itself and what it means. The most interesting part to me that confuses our conversations about innovation is definitions. Even at this conference, I've heard definitions that innovation is essentially invention. I've heard that commercialization is different than innovation. And I've heard that innovation is commercialization. Well, it can't be all of those, and I personally think that innovation really is commercialization. To me, invention is discovery. Innovation is when you put something to work practically in the marketplace. So if we could agree on that, I think it would be helpful, or if not on that, on some other common set of terminology. Now, what about lack of alignment? Well, in health, particularly, I think that the focus of health innovation seems to be on increasing the average age of mortality, whereas the public interest in health seems to be predominantly short-term and really more about accessibility. So the public doesn't think long-term, but the innovation industry is giving them long-term solutions. Whether that's good or bad, I don't know, but I think it does very much color again, the conversations that we can have. The scorecard that we use is also viewed differently by different stakeholders, so we don't really have a balanced scorecard in health, I would say. We have a scorecard that is contained because of our public system within the public sector by limiting access to contained costs, rather than thinking about effectiveness, which is probably what the public is more interested in, which really to them means timely access, which means delivery process improvements, or efficiency, which is probably what healthcare administrators might care about, which is sustainability and affordability, and certainly quality, which is that whatever we get works and works well. Again, I think probably patients care about. What about focus? Well, again, we have a challenge. Are we focusing on the right things? Certainly our efforts in health seem to be, especially in the drug development area, to target narrower and narrower populations with niche treatments at higher and higher costs, which essentially, if carried to the extreme, mean that the value of a life from the point of view of the health innovation system is infinite. And whereas in areas such as traffic safety or life insurance or a whole bunch of other areas where we're making similar decisions, there's a value of life that's quite different. And so we have a remarkably difficult challenge, I think, coming to grips with the fact that we obviously do not have the capability to provide absolutely everything anyone might want or need at an unlimited cost. The market in the traditional sense, with respect to focus, is therefore weakly considered. There's more focus on the possible rather than on what would actually help the system, and limited focus, as we've already heard, on the end user experience and the cost effectiveness of that experience. Along with that, we have a strategy that is not very coherent. It tends to see researchers tackling everything, if we look at the collective, rather than what might be the most important, and doing a little of everything versus doing a few things really well and trying to make a major statement out of Canada. I think there's some signs that that's changing, and I think some of the centers of excellence we've heard about and so on are moving in that direction. But at the moment, left to their own devices, we're not seeing that kind of focus. We also hear a lot about health care when actually what we're talking about is medical care. And if we actually focused on health care, which really is wellness, then we might avoid many of the problems of obesity, coronary disease, et cetera, et cetera. And so that's another issue, I guess. So the challenge of focus is to figure out what matters and decide on what basis we're going to set priorities. The innovation system itself, I think we have, at least to some degree, a flawed system or flawed assumption about how the system works. Again, I've heard something which seems to occur regularly, and that is the idea that there's an innovation pipeline, which implies that if we pour things in the front, things will come out the back. I think the system is a lot more complex than that, and really does have to incorporate the end user needs at an earlier stage. This isn't to say that you go predominantly to market pull, but staying solely on technology push isn't going to do it, because it doesn't lead to products, services, or capabilities that are designed with specifications that really align with user needs in a comprehensive way, which is not just on what they might do, but also in terms of how much it costs to do it, how long it takes to do it, whether I have the physical capability and the personnel to do it, and so on. Now finally, and I think in view of the time, I'll wind up with this, the design of the health system in Canada to some degree mitigates against innovation. In most sectors, SMEs are the source of creativity and innovation. Large and well-established organizations kind of have to tear themselves apart to change. As we heard at lunch, IBM is one of the few success stories of a company that maybe has done that a few times. But it typically is an unnatural event. That behavior is, as we've seen, is not common. Most major changes usually see the old guys dying off and new ones coming in and taking over. So the market imperative, in a sense, drives companies to change to survive, or else they die. Now, the health system is largely removed from that market discipline. Our current system has enormous inertia, and of course it preys on public fears to avoid change, and the political will for change is severely constrained because if you try to do anything, the public then responds, and the system encourages the public to respond. Whether that's adopting e-health records, and just so you know, Ontario is not the only one that blew it. 12 or 15 years ago, I was involved with a $1 billion exercise in Alberta to do an e-health system that's now starting finally to emerge. But you know, or refusing to accept a new treatment or drug and put it on the list or whatever it might be. And finally, of course, the health system to a large degree has ducked accountability, focused on risk avoidance, which means not doing anything to avoid liability rather than accepting and managing risk. And without taking some risk, there's never going to be any innovation. So I think with that, I'll leave you those thoughts and hopefully stimulate some interesting conversation.